B96, Chicago's #1 hit music station. Good morning, I'm Greg Murray. This is Chicago Connection, a public affairs program designed to give you information about goods and services that can benefit you. I have 5 questions that every woman should ask about hormone replacement therapy. That's hormone replacement therapy. Hormone replacement therapy. Now, this is a subject that I have absolutely not a clue about. And for that reason, we have someone who does have a clue. He's a doctor. His name is Dr. Ken Holtorf. Good morning, sir. How are you?
Good morning. Very good.
Now, doctor, I know absolutely nothing about hormone replacement therapy. Nothing about that. So why don't you educate us on what hormone replacement therapy is about?
Basically, hormone replacement therapy is replacing a woman's hormones as they drop through menopause. And there's significant controversy lately in relation to bioidentical hormones versus synthetic hormones. Bioidentical hormones are exact copies of what your natural hormones are versus the synthetic versions that are man-made and different that have been used for many years that are standard hormone replacement preparations. What has been found is that they are much safer and reduce risk for breast cancer, improved cardiovascular prevention with them. But there's been a lot of controversy regarding what is are these really better? And there's a lot of reasons for that, and one is doctors generally don't read the medical literature. And I just published a review of the safety of bioidentical hormones, reviewed all the literature, published in a major medical journal showing they're significantly safer. They have reduced risk of breast cancer, improved efficacy. Women have increased quality of life on them. But the problem is very few doctors will read this. Why is that? Basically, because, again, doctors they don't have time. They're going to read what the drug companies bring them. Now, if there was a drug company behind this, you would be all over the news. But so the problem is you get a controversy where people are saying, hey, the patients are confused, doctors are confused, saying, are these really better? Well, you have Oprah and Suzanne Summers promoting these, but people are still unsure. They don't think the science is there. But hundreds of studies have shown that these are safer and more efficacious, whereas none have shown that synthetic hormones are better. And so out here basically trying to get the word out that there's clear science behind these, and women really want to be on bioidentical hormones. And we can go through a couple of questions that patients can ask their doctors or to find a doctor on how to get proper hormone replacement. Okay, since you know absolutely nothing about that, that's not you, but me. Let's say I know absolutely nothing about this. I have no clue as to what questions to ask. So let's just play dumb. I mean, as I am, and on this subject at least. Now, what are the goals for taking hormones? Yeah, that's exactly. One of the first questions a woman should ask is, what are her goals in doing hormone replacement? Why is she taking them? Is it for symptomatic relief? Is it for hot flashes, anxiety, low libido, insomnia? Or is it for preventive medicine? Is it to prevent heart disease? Or is it to look younger? Or is it because my friend's doing it? I mean, so you got to ask why you want to do hormone replacement. And if it's symptomatic, which is the majority of women, you need to find a doctor that can adjust the hormone replacement and customize it for that patient for the particular symptom. For instance, if you're having mainly hot flashes, then you want to have a doctor that can use more of a bioidentical estrogen dominant preparation. If it's low libido, they want to get more of a testosterone preparation. If it's for anxiety, they want to have one that has more progesterone. So there's ways to customize them for the particular symptoms to best suit the women. So a woman really needs to find a doctor that can do that and doesn't just go to a doctor who has the one-size-fits-all. Right. So you need to know what type of doctor you need to go to. So how do you know? Exactly. So you need to ask around. We can have on my website, holtorfmed.com, they can email me. I can send them a list of doctors in Chicago that actually do this type of customized hormone replacement. That is a big problem because the standard doctors that would go to gynecologists and endocrinologists aren't trained in it. You have to have a doctor that's gone out and sought out this information and then to provide it for their patients. Are there risks involved? There's risk in anything. I mean, there's risk if you take an Advil. There's risk if you drink water, too much water that you can die. But the benefits significantly outweigh the risk, and those are preparations that we want to use. Now, if you use synthetic hormones, increased risk for breast cancer clearly shown, especially with the synthetic progestin that's in there, increased risk for stroke and heart attack. So, why are you taking those? People can get rid of some of their symptoms, but you want to prevent disease, not cause. So you look at bioidentical hormones, they're going to reduce the risk of breast cancer. Nice, very large studies showing this, and reduce the risk of heart disease while they're alleviating your symptoms. So you really want to use those preparations and not use synthetic hormones.
Gotcha. Okay, so when we're talking about menopause, is age a factor?
Well, age is definitely a factor. I mean, that's, most women are going to go through menopause around age 50, but it's highly variable. You'll have women in their perimenopause period, which is just that period of time before where they're not really in menopause, but they're having irregular periods, the hormone levels are dropping, they're having symptoms, and that can last anywhere from a month to 10 years. So there's perimenopausal and then there's menopause, and those both need to be managed separately.
Okay. So, doctor, we're talking about hormone replacement therapy. Some people say, I don't want to go through all that. Are there other options?
Well, there are, but when you look at, for instance, there's medications you can take, antidepressants, which are going to just alleviate the symptoms. There's seizure medications that people can take to reduce the symptoms. There's some herbal products. They don't work very well at all for the majority of people. So what you really want to do is just bring your hormones back up to the level that you were younger. Now, you don't want to use synthetic hormones. Again, studies clearly show increased risk for breast cancer and heart disease, and they're not very preventative. So you want to use, again, the natural bioidentical hormones and just bring the levels back up so you're getting health benefits in addition to alleviating the symptoms. Okay.
So, doctor, is there, you mentioned earlier about a website to go to get more details. Can you give that website again, please?
Yeah, so it's www.holtorfmed.com, HOLTORF med.com.
Fantastic. Well, I know how busy you are, doctor, so I'm not going to hold you any longer. Thank you for the time you've given us and all the info you've shared with us as well. And anyone who can really use this information, please put it to work, because a lot of doctors won't tell you because they just don't know. So you need to search it out for yourself. You can go to holtorfmed.com. Thank you so much, doctor.
Great. Thank you.
Have a great day, sir.
Bye-bye.